Welcome to another episode of the Nurses Heartbeat. So we are still looking at the NCLEX Unlocked series. So here we are looking at prioritization and delegation. We are making it so much easy to review your prioritization and delegation aspect of the NCLEX because these are key points or key topics that NCLEX will want to test you on, and we want to deal with it. Now, who do we delegate with? We delegate to our LPNs, licensed practice nurses, and then unlicensed assisted personnel. These are the people that we normally delegate responsibilities to. So what are their tasks? So in this episode, we are going to look at delegation and prioritization and the roles of these LPNs and UAPs as well. Very important how they contribute in the NCLEX exams. So let's dive in and go in quickly. So as I said, there are special roles that LPNs and UAPs play, or special tasks that they can take in their competence level that can be the right delegation for these people. Now, before that, let's look at the prioritization principles. Now, there are framework that we need to use during prioritization. The first one is the ABCs framework, where we want to look at the airway, breathing, and then the circulations. They are very important. So if patient is to be assessed, you need to use these processes to prioritize your assessment for them. Now, always address airway and life threats first before you go down. I've talked about this in previous videos. Then I have also talked about the Maslow's hierarchy of needs. So when we want to do prioritization, we want to look at the Maslow's needs, where he's talk about the physiological needs. They are the needs of food, shelter, clothing, the basic needs of a patient or a person that we need to prioritize before the other higher needs, like the safety needs, security needs, belonging needs, esteem needs. They are very important, but the basic needs should be met first according to Maslow's hierarchy of needs, and we should prioritize these basic needs first for the patient. And then under prioritization, we want to also look at stable versus unstable patients. When you have patients that one is stable, one is unstable, which one are you going to prioritize? The unstable one is your most priority. And then the unstable or new patients are RN priority or your responsibility. And then we also want to look at acute or versus chronic. So under prioritization, when patient is having acute condition and patient is having chronic condition, we are going to prioritize the one whose condition is acute. All right. So these are the things that we need to get going into the prioritization and delegation. So that is what we do. Now let's look at the uh, delegation basis. Delegations, we know that the RN, you are responsible for the patients, you are the team leader, and you will have your people under you to work with. So when you are in the UK, we have the nurse associates that they are the band 4. Other jurisdictions, they call them enrolled nurses. Like Australia, Africa, we have your enrolled nurses, and then we also have the healthcare assistants, and then other people they call the ward support and unlicensed assisted personnel. So they are all people that we delegate tasks to them at one point in time or another. But what are the tasks that we can give to these people? And that is very crucial, and NCLEX will test you on that. So quickly, we are going to look at the things that as a nurse you cannot delegate to any of these people, and the things you can delegate appropriately. So let's look at the things RN cannot delegate. Assessment, initial assessment of patient. When you receive a patient, initial assessment you are going to do yourself, and then even further assessment that needs to be done on the patient, you don't delegate them. So assessment, nursing judgment, it is you, the nurse, that you have to use. Nursing judgment, you don't delegate that. And then patient teaching is the responsibility of the nurse, you don't delegate. And then care of unstable or post-op clients or patients, they are the work of the nurse, you don't delegate these things. Now let's look at the LPN scope of practice. What are the things that the licensed practice nurse can do, the LPNs? So these are the things they can do that the nurse you can delegate effectively and efficiently to them. Monitor stable patients, administer oral and IM medications. Yes, the LPNs can do IM medications and oral medications. And then the perform wound care and catheter insertions, they can do as well. So as I said, don't get confused. The LPNs are the licensed practice nurses. Okay, the in the UK, you can call them nurse associates or the enrolled nurses in other jurisdictions. So these are the roles that they do. They also do wound care and catheter. They are just like the nurses, just few things they are restricted from doing. And they can also reinforce education. Remember that we said it is only the nurse that do patient teaching or patient education, but they reinforce the education already given by the nurse. That one they can do, and they can collect data and report to the RN. These are things they can also do. What the LPNs cannot do: one, do initial assessment. They cannot do initial assessment. So when you receive a patient and with all the initial assessment, you cannot delegate to the LPN to do. And then they cannot teach or evaluate learning. They cannot do that. They only reinforce the learning you have given to the patient or the education you have given to the patient, but they themselves cannot negotiate or initiate. That's the word, initiate the teaching. And then, even though we've said they can administer some IM medications, these LPNs cannot administer IV medications in most settings. So here in the UK, even the band for nurse associate, they don't do IVs, and that is it for the LPNs in most of the countries. They don't do IV medications in most settings. Now we have places like where I come from in Africa, the enrolled nurses, um, enrolled nurses, they do almost everything the nurses do, but this is the framework. This is what they are supposed to do. And when you are going to do the NCLEX exam, don't confuse yourself. If you're certain they do almost everything, these are the framework and the guidelines for the NCLEX, the things they can do and the things that they cannot do. And then care for unstable or newly admitted clients. These LPNs, they cannot care for unstable client and the newly admitted client. So if client is unstable, it should be the responsibility of the nurse and not the LPN. So the UAPs, things they can do: one, they can assist with activities of daily living, ADLs, like feeding, hygiene, dressing is their basic responsibility. They can take vital signs on stable clients. Stable clients, they can take vital signs. And then they can reposition and transfer clients as well. And then they can collect urine or stool specimens. The carers or the UAPs can do that as well. And then they can provide comfort measures to the patient. Things that the UAPs cannot do: administer medications. It is not in there. You cannot delegate to them to administer medications. They cannot perform sterile procedures. They cannot interpret data. They cannot teach, assess, or evaluate. And then they cannot care for unstable or post-op patient. So when you have any of these tasks, you are not going to delegate to the unlicensed assisted personnel. So that is it. So the few things they can do and the things they cannot do. So you have to know them as an NCLEX exam taker or a candidate. You have to know the things they can do and the things they cannot do, so that when you are delegating, you'll be able to delegate appropriately according to their field of competence. Now let's look at quick NCLEX question here. The nurse is assigning care to a UAP, unlicensed assisted personnel. Which task is appropriate to delegate? I hope by now you know what they can do and what they cannot do. A. Feed a client with recent stroke and dysphagia. Recent, that's acute. I don't think it's appropriate to do that. Measure intake and output for a stable client. Teach a client how to use an incentive spirometry. UAPs cannot teach. Administer subcutaneous insulin. They cannot do that. So obviously, the answer is measure the intake and output of the client. So that is how you are going to do it. Once you know the roles they do, and then those that they do not do, to help you to know what correct answers you have to take. And these are very key under prioritization and delegation questions. Having known the roles of the LPNs, the roles of the UAPs, and the roles of the nurse. I believe you as a nurse, you know your roles already. So you also know your roles, and then you'll be able to know how effectively you'll be able to do. As I told you, the NCLEX is a safe or safety clinical exams, and they want to make sure that you are going to prioritize and you are going to delegate effectively. I'll come to your way with questions about prioritization and delegation, and more about the roles of LPNs and RNs in the next episode. Thank you for watching. If you like this video, share to your colleagues, study mates, and everyone that it will benefit. Don't forget to subscribe and to click on the notification button so that you can have the videos that I upload in the future episodes. Thank you very much. This is the Nurses Heartbeat, where every heartbeat matters.